Hello, everyone. Welcome to the first episode in my interviews playlist on MCAT Crackers channel. Today, we have a special guest, Annabella Bajic. She's a fourth-year nursing student at the University of Windsor, and we'll be asking her some questions. Do you want to introduce yourself?
Hi guys, like Mudasim said, I'm a fourth year nursing student currently entering my final year of nursing at the University of Windsor. And yeah, I look forward to this interview.
Yeah, awesome. So we will start first with where did you attend your high school?
So I attended high school at two different high schools. I went to Riverside for 2 years, and then I went to St. Joseph's Catholic High School for 2 years as well.
Oh, awesome. So what experiences were you exposed to in high school which made you actually consider a career in nursing?
So in high school, I wasn't exposed to many experience and stuff, but I was a part of like clubs and homework help and things like that because I wasn't aware of all the different groups and study things you could be a part of until university. But what really influenced my career choice or pathway was because I have a member in my family that is in healthcare. So that's where it stemmed from.
Oh, awesome. And how was your final year at high school like? Was it mostly just taking courses, or did you have any special experiences to help you be like more eligible for the nursing program?
So for me in grade 12, my main focus was my marks, just because nursing is a very competitive program, especially coming straight from high school, which is what I did. So I know a lot of people took SHSM courses and they got certified in that. But for me, I just really focused on my grades, hoping to get early acceptance, which in my case did happen.
Oh, awesome. And when you applied for nursing programs, did you just choose the program at University of Windsor, or did you apply to other programs in Ontario or outside of Ontario?
So I applied to McMaster's nursing program, and I'm pretty sure I also applied to Western's program. I also obviously applied to St. Clair and the University of Windsor, and I got accepted into all four. And my pathway was the collaborative nursing at St. Clair College and the University of Windsor.
Oh, awesome. So I'm going to ask you actually, how does the application process differ for each of those four schools? Is it similar, or do they require any supplementary application? I also wanted to ask you, why did you choose University of Windsor Collaborative Program specifically?
So I'm currently in fourth year, so I kind of forget the application process, but I'm pretty sure it's just the same. You log in through the OCAS, you apply, fill out your information, show your transcript from high school, and then hope to see what letter of recommendations or offers you get in the mail, which I remember doing like it was yesterday. I remember checking the mail like every day, and I think it was February. And I actually got letters of acceptance from the schools. What particularly stood out for me was the collaborative program of St. Clair, because I did get an entry level scholarship with St. Clair because I did have good grades in high school, grades 11 and 12. So right from the jump, I knew like, okay, if I can keep these grades in my first year, I'll go to the University of Windsor St. Clair Collaborative Program. I also like the collaborative program because it gives you new environments. It gives you different connections. So not only are you getting connections from St. Clair College professors, but you're also getting different connections and meeting new people at the University of Windsor, which I thought was really cool. I also did the collaborative college and university program because more time in the clinical setting, which is something that I feel is an aspect. And yeah, that's just the pathway I took.
Oh, awesome. And how would you compare your first 2 years at St. Clair College to your last 2 years at University of Windsor?
So I do feel like St. Clair College has both have very good programs. The thing I like about the University of Windsor is that they offer peer mentors, which are students that can help with lab and have experience with things like we do for our OSCEs, which is our skills testing. So that's one benefit of the University of Windsor. At St. Clair, I feel like I did get a little bit more of hands-on experience through lab and through clinical hours, but they both work in collaboration, so it's pretty much the same thing.
Oh, awesome. I think then we will dive now deeper into the nursing program, which you have done. How did it go? Like from first year, second year, third year, what experiences have you been exposed to? How were the courses like? I would like to learn more about that.
So first year was a lot of theory-based courses. So your anatomy, your biology, your math, your things like that, and not too much like in clinical experiences until second semester, which is your first really experience to go in hospital. Second year was very difficult because it was very theory focused, and then a lot of lab, a lot of OSCEs, which is like your in lab examinations. And then also on top of that, you have clinical, which is like from first year to second year, there's a big jump because you learn more. So in first year, you only learn like PPE, which is putting on protective personal equipment, taking it off, washing your hands. You're not really allowed to do a lot of nursing skills just because you're not trained yet until second and third year. So I felt that in second year, it was a big transition. And then third year was an even bigger transition for me because it was transitioning to the University of Windsor. And by third year, you're kind of like getting ready to kind of be on your own, and you're learning a lot of skills and doing a lot of nursing skills like wound dressings, suctionings, inserting Foleys, which in first year you don't really get the chance to do just because you're not tested and you're not competent in those skills. And then in fourth year, I've really been enjoying my fourth year. So I have had my preceptorship with the Canadian Mental Health Association, which I just completed last week. And now I have my hospital preceptorship. Also, while in fourth year, I've had the chance to become an undergraduate nursing employee, which is something that you have the opportunity to do as a nursing student, which has also been a great experience for me. And in fourth year, you're pretty much completely independent. Once you get the clear from your preceptor, you're your own nurse and you're really getting prepared to take on the field as a future registered nurse of your own.
Oh, awesome. Apart from fall and winter semesters, which are pretty much packed with courses and clinicals, how do your summers usually look like?
So during my summer in second year and third year, I actually fast tracked a course just to make my course load easier in third year, because I did hear that third year transitioning from St. Clair to the university was hard. So I decided in second year to take a third year course, which kind of lightened up my course load, which was great. So I highly recommend doing that if you have the opportunity. It's called the Intersummer Courses. And I'm pretty sure I took the Human Meaning of Death, and then my nursing art, which was compositions, which is a writing class. So I found taking summer classes was really helpful.
Oh, awesome. And what fields in nursing have you been um, like directly working in now? I would say like what specialties, like mental health, surgery?
So I've been on general surgery, I've been on neuro, I've been on psychiatrics and mental health, I've been on family birthing, obstetrics, NICU, which is your neonatal intensive care unit. I've been on palliative complex. These are all at the different branches. So we have Windsor Regional Hospital, which is the Met and Olette campus. And then we have Hotel du Grace, which is separate on Prince Road. So there I really got to kind of strengthen my skills in the geriatric population, just because in Windsor Regional, I feel like I've really strengthened my med surge, which is like general surgery or neuro and stuff. So I've had placements pretty much everywhere.
Oh, awesome. So if you were to rank like three of those specialties, which specialties would you choose from those?
So in the future, during my nursing path, because I do plan to further my education, I do hope to become a psychiatric nurse or mental health nurse, or a PICU nurse, which is a psychiatric intensive care unit nurse. So my specialty, I would say my top three is community mental health inpatient, or PICU nursing, which is also psychiatric mental health. And I also enjoy med surge just because I feel like it really helps you with skills. It's a very fast-paced environment, which is something I thrive in. And med surge prepares you, I feel like, if you want to be an emergency ER nurse or ICU nurse in the future. So I would say those are definitely my top three.
Oh, awesome. So as a fourth year student, and like since it's your final year, you're about to graduate, what advice would you give to a first year nursing student and also to a high school student interested in a nursing program?
I would just say keep striving. Like, it can be tough, just like any health science or science program. Sometimes you feel like you want to give up, but just keep going. You make someone's day better every time you enter the hospital. So just if you enjoy it, keep striving and keep going. And I promise you will get better and you'll learn all the things you need to learn with
Oh,
time.
awesome. And any specific experiences they should consider like being involved in coming from high school?
I would definitely say be involved in like clubs because in high school I didn't really have the opportunity to be a part of many clubs. I did help with homework help and things like that, but me being a part of the general science club, I was a part of the stem cell club before. I've met many new great connections, and it helps you stem off with your career. If you're not just interested in nursing, if you're going into nursing to become an MD, I would say just as many opportunities as there are on campus, take them, join clubs, be a part of research. And also, like for the university students, I would highly recommend booking lab times and just practicing like things like dressing changes or things you're not really certain on, because it gives you that chance to really work on things before you're actually in a hospital doing it on real life people. So really utilize what you're paying for is pretty much what I'm saying.
Awesome. Those are some good advices actually. Having worked with physicians and also nurses, what would you say is the primary difference between a physician and a nurse in terms of how they practice and in terms of how they interact with patients?
In my opinion, I feel like everyone in the hospital has an equal role of like providing patient care and making sure that they're providing the best patient care. So I would say the major difference between nurses and doctors is their ability to prescribe. So nurses currently don't hold the title to prescribe or diagnose unless you further your education as a NP. So I would say everyone works in collaboration for best patient care, but the major difference is just diagnosing and prescribing medications. Other than that, not much of a difference.
Oh, awesome. Yeah.
Both are
I,
very knowledgeable in their fields.
yep, awesome. I heard that like nurses, physicians, physician assistants, also person support workers, they all work in harmony for advocating for patients' health.
For sure. It's the hospital is all harmonicized system. So I agree with that.
Yeah, awesome. It was nice having you on my channel, and good luck on your future endeavors.
Thank you so much.